Thank you, Howard, and thank you, Carol, for co-chairing this day and organizing it. Mr. President, dear fellows, colleagues, I'll just take some time to share with you what is this dementia challenge that we'll discuss today, and will orient the work of the Academy. And you'll have, of course, much more details on some of the things I will barely just allude to. Just as as we will be enjoying in the next hours, days, years, decades, hopefully, Canada is aging. And it's aging in a steady manner over the last 50 years and still aging. Of course, some countries might attain a plateau, and will learn from maybe Professor Banerjee about this epidemiology of aging. But Canada is aging. The latest WHO figures is a life expectancy, which is more or less similar. The difference between men and women has is much smaller than it was. But overall, the population in Canada of 65 and plus in 2036, by reference to 2009, will be nearly double and will represent nearly a quarter of the Canadian population. That's the good news. The challenge with the aging of the population is that we're not interested in the life expectancy, we're interested with the healthy life expectancy at birth. And there is a difference between both, which is about 10 years, which is a little bit longer in women than in men. And this life expectancy at birth is accompanied, in fact, with health challenges. Among these health challenges, the most feared one for the whole population, surveys after surveys, are cognitive disorders, dementia. And the characteristic that you have to keep in mind in all the discussions today is that dementia prevalence is like in the estimated between 5 and 7% for the 60 and plus by the Canadian study on aging. But it's as you move forward in the 80 and plus, it's more than 35% and even larger. So age is a risk factor for dementia. The other thing to keep in mind is that, unfortunately, 2 women for 1 man are suffering from dementia. It's not accountable only by the life expectancy difference. Dementia is due to neurodegenerative diseases, and these diseases, such as this model for Alzheimer, which is one among many others, are characterized by the fact that there's a period where the dementia is there on the right side, there's preclinical signs in the middle, the mild cognitive impairment, but for 15, 20 years, as you will hear during the day, and maybe more, there are changes, and the disease itself is in the brain, and is not clinically manifest. So it means that the research has to, of course, look at the care for those with dementia, at cure or delays for those in the course of going towards the dementia, and also towards a prevention in order to prevent the cascade of events to occur initially, in order to skip this whole trajectory. Now, if the Canadian population is aging, and just keep in mind what I just said, this is the world. More or less now, this is the world 2050. The world is aging, and the world is even aging more rapidly than Canada. And in fact, you have here a typical comparison between the fact that France took about 120 years to double the percentage of over 65 in their population. We were rapid. We took only 60 years, more or less. Chile, Brazil is doing this in 20 years. 20 years to double the 65 and plus. So, and moreover, the aging of the population is not only a flat aging of the 65 and plus, it's also a complex series of result of the advancement of science, where the oldest among the older are more and more present and prevalent. And in fact, the world global boom today are centenarians. So if you make, if you put A plus B plus C, this is an explosive cocktail. And the explosive cocktail is here, where there is about 40 million people with dementia today. There will be 135. And the distribution globally is not equal. This is from Martin Prince and this group in London, but we see here in dark blue that 63 million of the 135 predicted for 2050 are in Southeast Asia. So this is a challenge which is truly global. In Canada, the economic costs are enormous, but the social costs are even more bigger. Every 4 seconds on this planet, someone is diagnosed with dementia. This is why the Alzheimer's Society of Canada took the lead and rang the bell in 2010 and published this Rising Tide, the Impact of Dementia on Canadian Society. And then the World Health Organization published in 2012 a document along with Alzheimer's Disease International. And Margaret Chan from WHO now recognizes dementia as a public health priority. This triggered, as Dr. Feldman alluded to, in 2013, a G8 rapidly becoming a G7 effort and a call for action from the presidency of the G8 at that time, Prime Minister Cameron, which, by the way, is a nice example of politicians having an impact in an area of public health and science, and introduced a collective effort among G8 countries called the Global Action Against Dementia. As Dr. Feldman reminded us, we organized last year, nearly day to day here in Ottawa, one of the legacy events. It was focused on the necessary synergy between industry and academia, and not only industry in terms of pharma, but also in terms of medical device and IT industry. Now, the World Dementia Council was also created by Prime Minister Cameron. Its envoy, Dennis Gillings, made a terrific effort during the year and a half, and very practical things emerged. The World Dementia Council is not a funder, it's not a doer, it's stimulating other stakeholders to get their attention to dementia. For instance, there has been the publication of a OECD document, along with Ontario Brain Institute and the University of Toronto, I have to underline here, on the importance of big data in dementia. Another impact was Raj Long, a colleague who's a member of the World Dementia Council. She's responsible of regulatory processes at the Bill Gates Foundation, and she went all over the world, met with all the regulatory bodies, including Health Canada, in order to imagine ways of getting quicker, swifter towards potential solutions for when we will have them in the pipeline of research for those having to live with dementia. More importantly, last March in Geneva, after a year and a half of this global action against dementia, bringing together the G7 countries, WHO called the first ministerial conference on global action against dementia. And it's quite impressive, and I'm very happy to share with you that we went from G7 to, let's say, G80, because 80 countries have signed the call for action, including 17 from the Americas, including Canada, the States, Mexico, and a lot of other countries of South America. And in this call for action, there is a lot of things that are, let's say, required by countries, or countries have committed themselves, including having a dementia plan. In Canada, we have such a plan which was announced in March by our Minister of Health. For those who are not from Canada and are from outside, you will not understand why this plan is only devoted to prevention and research, and it does not include care, but it is for obvious jurisdictional questions between provinces and the federal government. In any case, we have at least this plan, which includes, among others, something that might be popping up today about the Alzheimer Friend, Les Amis de la Santé Cognitive program that is there to easy off the living of people with dementia in their everyday. Now, for me, the highlight of that plan is at CIHR, our dementia research strategy. And the dementia research strategy has two arms. One that you will hear from Dr. Chertko later on this morning, which is the Canadian Consortium on Neurodegeneration and Aging, bringing together all universities, research centers, working together, not against each other, working together on the spectrum of challenges I just showed with the trajectory slide. The other is the international involvement of Canadian researchers and the necessary international involvement, because this is a too big challenge to face only us alone. And so, as an example, the Centers of Excellence in Neurodegeneration or the Joint Programming on Neurodegenerative Diseases are alliances where Canada is now the only non-European country full member of these initiatives. So my last slide is simply to say how relevant is this topic for this forum today. We need the Academy unique thinking and point of view about the unique Canadian contribution to this Canadian, but also global challenge. And I would like to thank the Academy, the organizers, and all the speakers, and all of you who will participate in the discussion today. Thank you.